If you are a nurse who wants to migrate to Australia, you may be wondering what prerequisites you need to meet for migration process. Australia is a popular destination for nurses who want to work and live in a country that offers a high quality of life, a diverse culture, and a strong healthcare system. However, migrating to Australia as a nurse is not a simple process. You need to meet certain requirements for both immigration and registration as a nurse in Australia. In this podcast, I will explain the main prerequisites for the nurses who want to migrate to Australia and provide some tips on how to prepare for your migration journey. To migrate to Australia as a nurse, you need to apply for a visa that allows you to work and live in Australia permanently or temporarily. There are different visa options for skilled nurses who have local or international qualifications, language skills, and relevant work experience. Some of the most common visa options are 189 Skilled Independent Visa, 190 Skilled Nominated Visa, 491 Skilled Regional Provisional Visa, 482 Temporary Skill Shortage Visa, 186 Employer Nomination Scheme Visa, 494 Skilled Employer Sponsored Regional Provisional Visa. 189 Skilled Independent Visa is a permanent resident visa for point-tested skilled workers who want to apply for permanent residency independently. You need to score at least 65 points on the points test based on the factors such as age, education, work experience, English proficiency, and other criteria. You also need to have your occupation on the medium and long-term strategic skills list, which includes various nursing options. 190 Skilled Nominated Visa. This is also a permanent residence visa for points tested skilled workers who want to apply for permanent residency with the nomination of an Australian state or territory government agency. You need to score at least 65 points on the points test and have your occupation on the short-term skilled occupation list or MLT-SSL. You need to meet the specific requirements of the state or territory that nominates you. 491 Skilled Regional Provisional Visa. This is a provisional residence visa for points tested skilled workers who want to work and live in a regional area of Australia for up to 5 years. You need to score at least 65 points on the points test and have your occupation on the STSOL or the MLT-SSL. You also need to be nominated by an Australian state or territory government agency or sponsored by an eligible relative living in a designated regional area. Now let's talk about employer-sponsored visas. These are visas that allow you to work and live in Australia temporarily or permanently with the sponsorship of an Australian employer who needs your skill. Some of these visas are 482 Temporary Skill Shortage Visa. This is a temporary visa that allows you to work in Australia for up to 4 years. Depending on your occupation and employer's needs, you need to have your occupation on the skilled occupation list and meet the skill level and work experience requirements for your occupation. You also need to have a valid job offer from an approved sponsor. Next is 186 Employer Nomination Scheme Visa. This is a permanent residence visa that allows you to work and live in Australia permanently with the nomination of an Australian employer who needs your skills. You need to have your occupation on skilled occupation list and meet the skill level and work experience requirements for your occupation. You also need to have a valid job offer from an approved sponsor. Next is 494 Skilled Employer Sponsored Regional Provisional Visa. This is a provisional residence visa that allows you to work and live in a regional area of Australia for up to 5 years with the sponsorship of an Australian employer who needs your skills. You need to have your occupation on the regional occupation list, which includes various nursing occupations, and meet the skill level and work experience requirements for your occupation. You also need to have a valid job offer from an approved sponsor. To apply for any of these visas, you may also need to undergo a skill assessment by an authorized assessing authority such as the Australian Nursing and Midwifery Accreditation Council, NMAC. NMAC is an independent organization that assesses the skills of internationally qualified nurses and midwives who want to migrate to Australia under the General Skilled Migration Program. NMAC takes into consideration your qualifications, work experience, and professional references in assessing your suitability for skilled migration. To work as a nurse in Australia, you also need to apply for and be registered with the Nursing and Midwifery Board of Australia, NMBA. NMBA is governed by the Health Practitioner Regulation National Law as in force in each state and territory and is responsible for regulating the nursing profession in Australia. NMBA sets the standards, codes, guidelines, and policies that nurses must follow in their practice. To apply for registration with the NMBA, you need to meet the following prerequisites. Number 1, education qualifications. You need to have a qualification that is substantially equivalent or based on similar competencies to an Australian nursing qualification. The NMBA has a list of approved programs of study that lead to registration as a nurse in Australia. If your qualification is not on the list, you need to submit your academic transcripts and course syllabus for assessment by the Australian Health Practitioner Regulation Agency, AFRA, which manages the registration process on behalf of NMBA. Next is English proficiency. You need to demonstrate that you have sufficient English language skills to practice safely and effectively as a nurse in Australia. You can do this by providing evidence for one of the following. Number 1, completion of secondary education in English in Australia, Canada, New Zealand, Republic of Ireland, South Africa, United Kingdom, or United States of America. Number 2, completion of tertiary education in English in Australia, Canada, New Zealand, Republic of Ireland, South Africa, UK, or USA. Number 3, completion of an MBA approved program of study in Australia within the last 2 years. Number 4, achievement of the required minimum scores in one of the following English language tests within the last 2 years. International English Language Testing System IELTS academic test, overall score of 7 or more and minimum score of 7 in each of the 4 components: listening, reading, writing, and speaking. Occupational English test OET grade B or above in each of the 4 components: listening, reading, writing, and speaking. Pearson Test of English PTE academic, overall score of 65 or more and a minimum score of 65 in each of the 4 communicative skills: listening, reading, writing, and speaking. Test of English as a foreign language internet-based test, total score of 94 or more and a minimum score of 24 in listening, 24 in reading, 27 in writing, and 23 in speaking. Competency assessment. You need to demonstrate that you have the knowledge, skills, and abilities to practice as a nurse in Australia. You can do this by completing one of the following pathways. Number 1, Objective Structured Clinical Examination OSCE. This is a practical exam that assesses your clinical competency in various scenarios. You need to pass this exam if you have not practiced as a nurse for more than 5 years, or if your qualification is not substantially equivalent or based on similar competencies to an Australian nursing qualification. Number 2, Bridging Program. This is a short course that prepares you for registration as a nurse in Australia. You need to complete this course if you have practiced as a nurse for less than 3 years in the last 5 years, or if your qualification is substantially equivalent or based on similar competencies to Australian nursing qualification but does not meet some specific requirements. Number 3, registration standards. You need to meet the registration standards set by the NMBA for professional indemnity, insurance arrangements, residency of practice, continuing professional development, and criminal history. Now, some tips for migrating to Australia as a nurse. Migrating to Australia as a nurse can be rewarding and fulfilling experience, but it can also be a challenging and complex. Here are some tips to help you prepare for your migration journey. Plan ahead. Start your research and preparation as early as possible. Gather all the necessary documents and information you need for your visa and registration applications. Check the eligibility criteria and processing time for each option. Seek professional advice from a registered migration agent or lawyer if you need assistance with your visa application. Choose the right visa option. Consider your personal and professional goals and circumstances when choosing the visa option that suits you the best. Compare the benefits and drawbacks of each option. Think about factors such as cost, duration, location, eligibility, pathway to permanent residency, and employer sponsorship. Prepare for the English language test. If you need to take an English language test for your visa or registration application, make sure you prepare well for it. Familiarize yourself with the test format and content. Practice your listening, reading, writing, and speaking skills regularly. Take mock tests and get feedback on your performance. Enroll in an English language course if you need extra help. Prepare for the competency assessment. If you need to take the OSC or complete a bridging program for your registration application, make sure you prepare well for it. Review your nursing knowledge and skills. Familiarize yourself with the Australian healthcare system and nursing standards. Practice your clinical scenarios and communication skills. Seek feedback from your peers and mentors. Network with the other nurses. Connect with other nurses who have migrated to Australia or are planning to do so. Join online forums and social media groups where you can share your experiences and insights. Seek advice and support from other nurses who have gone through the same process. Learn from their success and challenges. Migrating to Australia as a nurse can be a challenging task. So if you are a registered nurse with minimum 3 years of provable experience and confident to meet language proficiency required, then drop your detailed CV at info@visatoland.com. Visa to Land is a registered consultancy approved by Omara, Department of Home Affairs, Australia. For more information, you can visit our website www.visatoland.com. Thank you.